msikilizaji yote akiwa ni ndani ya Peace FM, chaguo bora tusema ni neema juu ya neema kujaliwa kwa pamoja nawe.
In Kenya, a generation of young people is rising, resilient, bold, and determined to claim their right to health, dignity, and equality. From the streets of Nairobi to the informal settlements of Kisumu and the coastal communities of Mombasa, their voices echo beyond the hashtag, demanding action, justice, and lasting change. At the heart of this transformation is the Network for Adolescent and Youth of Africa, NAYA.
This project is being implemented in 3 counties where we are in partnership with 7 other organizations, and it also comes to us under the donorship of the Dutch Ministry of Foreign Affairs. In these 3 counties as NAYA, in Nairobi, Mombasa, and also Kisumu counties. This project builds on the momentum of Right Here, Right Now 1 and also the GUSO project, where we capacity build young people and also sensitize them on their rights, particularly looking into sexual reproductive health and rights. And after this, we saw the need to also capacity build them in how they interact with policymakers, especially ensuring that their needs and their asks, particularly with services and SRHR information, are embedded in policy documents, as this would also ensure that they are embedded or they're budgeted for to ensure the sustainability of these services.
As an organization, we've worked with NAYA through the Right Here, Right Now project in terms of even mobilizing the youth to be in their spaces, specifically to work with the county leaders. And for us, working with the youth mainly means issues around their civic engagement. How do they get involved in issues around policy making, public participation, and budget making processes? Similarly, we've worked with NAYA in terms of just mobilizing the youth to be part of community engagements around SRH engagements that NAYA has, mostly on even getting their input or feedback on some of the policies that are being developed by the county government of Kisumu in relation to sexual reproductive health. We've even tagged them along in terms of developing memos, in terms of just influencing some of the issues that are not part of those SRH policies at the moment.
Through the program, the Right Here, Right Now program, they've really trained us on capacity building and writing our reports and proposal, because tulikuwa na issue, we do activity, we can't track the report, how the activity was conducted, ambaye hata when we try and reach out for proposal and all that, tunaona inakuwa rejected, alafu mnaambiwa bado haija meet the standard. But sasa through hizo trainings nani, at least sahi in as much as we don't have a funded program, but proposals zetu sahi compared to kitambo, they are very different. Saizi compose vizuri. Again, wao wanakuja na hizo some of the products that we need for some of our activity, kama za menstruation, we get sanitary towels, na wanatuletea hapa hivi, young girls are getting sanitary towels for free during hizo engagements zetu. The condom dispenser installation, because this is an activity yenye ilitoka, one of the action plan that we gotten through activity yetu ya SRHR in the slums.
Okay, we have a good working relationship with NAYA. We've done a number of activities together in partnership. Number one, we had an event for the youth called 360 Youth Engagement. The event was aimed at bringing the youth together and attaching them or linking them to service providers and opportunities that are around. It was a success because out of that event, I can say that there are a number of youth who got opportunities. Some got opportunities for trainings, some got job opportunities, some also got linkages for business. So I can say that it was a success.
The Committee on Medical Services Public Health has had an exemplary collaboration with NAYA, especially on the SRHR program, which I think has really advanced the health and well-being of the adolescents and youths of Kisumu County.
Through the Right Here, Right Now program, NIA has played a vital role in shaping progressive policy formulation, ensuring that youth priorities are reflected in county and national strategies.
For the longest time, even during Right Here Right Now 1, Kisumu County was not in the space of developing a sexual reproductive health policy or bill. But as now, we have a Kisumu County Sexual Reproductive Health Bill 2024, which was actually started, the process was started last year. In April, we went for its second validation. So we are very optimistic that by the end of this year, 2025, we'll have a bill.
You know, we had a policy and there was no act. And that's why we are speaking of currently we have the Kisumu County Sexual Reproductive Health Bill. So it means if this becomes law, it means now the policy can also justify allocations of resources, which has lacked. Most of the time you see budgets are being shifted here and there.
In the first phase of Right Here Right Now, they started the process, but because there were aspects of gender minority and issues around inclusivity featuring in that policy, it was drawn back. But right now, we've seen them embracing change.
If you look at the objectives if you look at the objectives of that act, I think after this maybe I can share with you a copy. You look at the objective, it contains all those. It provides safe spaces, non-discriminatory, the drugs, all those, they're there. Yeah.
By engaging policymakers directly, they have brought the voices of the young people into the very rooms where decisions are made.
We've done a number of legislations together, like amending the Reproductive Health Act, Mombasa County Reproductive Health Act, which was passed long time ago and had a number of challenges. So we came up together, reviewed the document, and we are about to bring it to the assembly so that it can be passed.
When we see Mombasa, where we supported the AYP strategy, and also in Kisumu, which they are in the process of enacting a bill, gender and equality bill, given that they developed the gender policy. This act will ensure that there is the sufficient allocation to young people in their reproductive health and all other avenues that affect them as young people.
This project has really come out strong in terms of advocating for budget allocation. And for the county, I know we mentioned that we have AWPs that are costed, and there is allocation for every project and every program. So for adolescents and young people, I think the advocacy part has really played a key role in terms of increment in the budget allocation.
NIA has convened countless youth dialogues, giving adolescents the courage to speak openly about their sexual and reproductive health and rights.
Nobody understands the context and the challenges that young people face more than the young people themselves. So when young people lead the conversations, when young people lead the interventions, when young people lead advocacy for what truly affects them, the odds of better outcomes increases because they are likely to address the root cause and in a way that is more relatable to the challenges that they face.
To bring in-house stakeholders within the area, and we discuss with the support of the program Right Here Right Now, we discuss with them some of the challenges that youths are facing and young people are facing up our community and how they can support us. So we have the gender officer, we have the gender desk pale kwa police station.
We've integrated them in our community health as community health promoters. We also have peer educators among them who we work very well at the facility level. Then we've also been able to reach out to the youths that were not targeted there before. You see, previously you could tell the CHPs just bring the adolescent and young people, but they could bring for you the most disciplined ones. But right now we changed strategy. So we wanted those ones that people did not want to engage with. And I can attest we've gotten very positive feedback from the engagements that we've been having with them.
In this country, one of the things that we've seen, and especially for young people who have been involved with NAYA, is the fact that they get trainings, hands-on trainings. Whether you've never been part of this process before or you have ever been, you still get to be trained on a regular basis. And therefore that gives you the opportunity to really learn and understand ways in which you can also be part of the governance.
When we had one of our sittings, the talks we hold with the youths, supported through NAYA, they raised a concern that they were not very comfortable coming to receive SRH services where we were doing it, because then they sit together with their parents. This being a community facility, they meet their parents, their uncles and their aunties. So they felt there was need for to have a designated place for them. We've not been able to roll out a place where they can be seen every day, because currently we only have 2 clinicians. But we've been able to hold days when we just have youths in the facility. We call it youth engagements. Such days it is just them. They come, maybe if it is a Friday afternoon or a Saturday, they come, we offer them the services they want, the STI screening, FP/RH services for them. That is the far that we've been able to go to this far.
They have trained county officials and health providers to respond with compassion and inclusivity.
There's a lot of behavior change, a lot to know about HIV, gender-based violence. Then the service uptake has gone up. Previously, we didn't have the adolescent, as I told you earlier. We didn't have the adolescent youths coming to a facility for fear of stigmatization, attitude, and so many things, and also the myths and misconceptions that they usually get from their other peers. But when we started engaging them right at the community level, we've seen a number of them coming to the facilities and also referring their friends for SRHR services.
Sasa katika swala zima hili ambalo ni la kisa cha dada yetu Rose kwa jina ambalo ni la kupanga, ambaye alikuwa na tatizo la kujipata katika mazingira tatanishi, amebakwa na wakati mmoja hana mali ambapo ni pa kuishi, anahangaika, anatafuta na mwishowe akapata tena tatizo la ugonjwa ambao ni ukimwi. Je, tunaweza tukawasaidia vipi kina dada zetu ambao wanajipata katika mazingira tatanishi wakakosa la kufanya?
They have also mobilized media, from radio stations that reach into villages to digital spaces where young people connect, creating powerful avenues for journalists to share information that is transforming communities.
So we worked with journalists and also capacity built the young people to do the grassroots reporting and those articles to have the representation of the voices of young people at the center of it.
When I was included in this program, one of the things that I found out is that we have to be very clear and look at issues that are affecting us. Then we should create conversations that are very constructive in terms of looking at what are the problems, you identify the problems, then look at what are the possible solutions to those problems. And that's something that I really appreciate to have been given information mostly that normally help us in terms of how do we try to help the society come up with the solutions to issues that normally affect the society without necessarily just complaining and leaving it as like that.
Through NAYA, we've been able to now get more opinion stories, the op-eds, and publish them on the newspaper, and even some go on digital platform. NAYA has been very supportive, getting youth to talk about the reproductive health issues, especially youth from the informal settlements.
We've had radio talk shows that NAYA has sponsored, has helped us with, through maybe, they helped us with through talking to the radio stations, and we go there as a committee. We try to talk to the public, we try to create awareness to them. We try to tell them that they can go to the hospital without fear with the issues that they have. And I think along that line, we saw a gap. We realized that in Kisumu County, we don't have a legislation on sexual health, reproductive issues. So we sat down and we said, what if we develop a legislation? And that is how we birthed something called the Sexual Health Reproductive Bill.
There's this feature I still remember. We had a lady who is actually among those who are normally called the sex workers. She was narrating that story, and in that story you could really see that there are gaps, we have gaps in the society. So most of the times, like the society, we're always judgmental. We try to blame or like put blames on people. You know, it was because she didn't do this right. But when you look at these stories, they originate from somewhere. And what happens, something good about this feature story, is that from that feature story we had, there were a number of others that were coming up to now speak. So you see, it's just one that has now created a space, meaning that there's someone who will want to identify with that. And he now has that the courage to speak about something that also had happened to him or her sometimes back.
Through NAYA and its partners, youth-led organizations have turned silence into conversation, stigma into support, and isolation into community.
Tunatry kufinika ile gap because again the end goal ni reduce teen pregnancy and new HIV infection. But how are we doing it? It's through having those discussion and conversation. So right here, right now has been really impactful through that, and since 2022 they've been really nice, especially wao wanakuja. Something unique about them is that wao kuja for the activities. They don't just send you the funding, you go and then you send report. They come.
But beneath the progress, young people continue to face barriers. In too many spaces, conversations on sexuality and gender are silenced, leaving the most vulnerable exposed to stigma, exclusion, and misinformation.
So the media houses still feel that the SRHR issues are a bit of sexual issues. Yeah, when you talk about gender-based violence in men, they say that no, this we cannot put this one here. Let's hide it somewhere. But it doesn't need to be hidden. So you write a good story, you take it to the editors, and then if you don't follow up, how is my story coming along? Then when you see the end product on the newspaper, you'll find that it is something else. And that is one of a bigger issue that we've had with several organizations where we are called to these forums, especially on reproductive health issues. Then we are being warned that now you've had everything here. Don't go there and come up with the very, very funny headlines.
Naam, ni swala ambalo limekuwa haswa changamoto japo kwa kiasi kwa wanahabari, lakini tunashukuru pia kwamba kuna vikao ambavyo vimekuwa vikiendeshwa na tunakumbana na wataalamu mbalimbali ambao pia wanatupa maelekezo, hasa wakuu wetu katika tasnia ambao ni ya wanahabari, kwamba ni vipi tunaweza tukafikisha ujumbe hasa kwa masuala ambayo yanahusiana na afya ambayo ni ya uzazi kwa watu ambao wana imani zile ambazo zinaitwa imani sugu. Lakini tukawa tuwaelezea si kupingana na imani yao ama namna wanavyodhani, ila tunaangalia ule ubora na umuhimu kwamba kwa nini iwe hivi tunavyowaeleza ikilinganishwa na namna mnavyoshikilia. Na utapata kwamba kuna wengi ambao wanachangamkia, manake ni swala ambalo linaleta manufaa ikilinganishwa na ule msimamo mwingine ambao wao wanao kwamba pengine hawataki kupata hii huduma ambao ni afya ya uzazi kwa sababu wameambiwa na kiongozi wao ambao ni wa dini, lakini hajawaeleza kwamba madhara yapi ambayo watapata ikiwa hawapati ile huduma ambayo ni ya afya.
For the state duty bearers, people who are in spaces, decision making spaces, you may think that this is about religion, culture, and many other practices. But very soon it's hitting home, and this is not a threat. It's gonna catch up with us very soon. Until this statistics starts becoming faces that you know. The statistics of GBV, the statistics of teenage pregnancies, until they become faces that you know. it might be a little too late. Let's have these conversations about how best we can address these needs for young people, because their futures depends on it.
Young people navigating diverse identities often face criminalization and rejection, their human rights denied in the very spaces meant to protect them.
The main challenge that we've been talking about for like forever is stigma and discrimination. As much as we're saying that healthcare providers are sensitized, they have this information, but in real sense, it is not that way, because up to this point, with all the advocacy work that has been done, if you go to any public health hospital and you go there as a trans person, you go there like openly queer person, you still face stigma and discrimination. You still be discriminated. You still have challenges even accessing people to get you the services that you need. Well, this comes from lived experiences, and I'm a queer myself, so I actually know the struggle, and I understand how it feels to be queer and how it feels to be a young person at the same time.
Initially, I remember when this issue of gayism had just come in, there was a lot of stigma. And I remember we went through a number of training sessions to help us just accept them and receive them back to receive care from us. Currently, in this facility, they come. There's no any stigmatization. And they feel free with the clinician that we have, because it also depends on the service provider. If they come and they feel like they are not welcome, then they don't come back. But if they are treated with confidentiality, then they come back. So here it has not been an issue.
The last time we were going for HIV test, and I hate to say this, but we were chased out. Yeah, so I am here wondering why isn't SRHR services equal for all of us? I just wanted to know my HIV status. So in times like that, because most of the time you'd be asked, who is this to you? I'd say it's my partner, and you're like, we don't do that there. So that has been a challenge. Yeah, or sometimes we just go for clinic with the partner and we want to do it as a couple, and we are treated somehow. And like if I was to walk in with a man, because that is what the society expects I should be doing.
So when it comes to inclusivity and gender minorities, we are in the forefront. We have our partners that are keen and are working with us hand in hand to ensure that we are trained as partners also, so that we are value and attitude clarified on how are we able to engage with the gender minorities and the queer. Secondly, also we have other partners and other coalitions that we work with, such as Mekwe, that are very keen on issues around intersectionality, what you've talked about, to ensure that you can be a Muslim with disability and you are a lady living in a informal settlement. So you have all these dimensions that are really affecting you. So as NAYA, we are very keen, and we have actually incorporated the aspect of intersectionality in all our interventions at the right now, and we even partnered with Mekwe program to ensure that we understand deeper on issues around queer people with disability and every other aspect that young people are undergoing currently.
I've been able to navigate stigma and discrimination is basically doing more sensitization. Yeah, as much as we have those bad elements in public health facilities, but we also have good people there. People who are like understanding, people who like you are there to get services. Yeah, they don't care about what you do with your private life. So we use those people to get into such spaces. Once we sensitize them, then it's easy for them to sensitize their fellow colleagues, because coming from them, it will be easy for the colleagues to understand, for the colleagues to actually embrace.
An organization like NAYA has empowered me as a queer person by giving me knowledge on facilities that are queer friendly. One, it has built my confidence because they gave me an opportunity to facilitate. And three, it has given me a bigger audience on queer people. So now I know a larger audience. That means my reach to them has been wider. At least now I feel I can share the knowledge I have with the wider group. Yes, and that is a win for me.
The digital world, while offering new opportunities, has also become a site of harm. Technology-facilitated gender-based violence threatens mental health and silences voices online.
The landscape for SRHR in this country at the moment is being dictated by so many emerging issues, and the solutions have to evolve. We have to keep up. For example, while we were still grappling with access to youth-friendly services, even in the offline spaces, while we were still grappling with the triple threat, the online spaces where young people converge has become insecure. Now we are talking about, for example, GBV as one of the triple threats. We are talking about technology-facilitated GBV. So it will take the person who is flexible. It will take a system that is flexible and committed to keeping up with the emerging trends to be able to solve these problems completely.
For young people living with HIV, the challenges are even sharper.
Mtu ambaye anaathirika kwa virusi vya ukimwi, unapata ni changamoto sahi. Kuna kitu wenye wanatolewanga kila mwaka inaitwa viral load. Unapata hizo chupa azimo. So unapata mtu anakuja na access ni services but hatatolewa damu. Alikuwa amepanga kutolewa damu kulingana huwa wakati but hatatolewa damu. So unabidi unamwambia nenda ukuje. Na yeye anataka kujijua hali yake iko vipi, jinsi venye anaendelea.
Odd working hours often force them to miss vital appointments to collect ARVs, but through NAYA's trainings, health providers are learning to be more flexible and accommodating, making treatment more accessible and restoring dignity to those whose voices are often ignored.
Saa nye mimi namaliza kazi na nikienda hospitalini, unapata ni vigumu sana, unapata masaa imepitana, unaambiwa kuja wakati mwingine, unaona. So unapata wakati mwingine ulikuwa hiyo kitambo ulikuwa unapata unaweza pigia mtu umwambie ni aje doc niko mahali fulani nimeshikana hivi, unaweza pata nipatilia nini mzigo wangu, ama unaweza nisubiri kwa muda fulani na nikuje nikaweza kuchukua vitu zangu kwa sababu nimeshikika, kwa sababu sina kazi nyingine ila hii. So unapata zinapitana kwa kidogo. Yeah.
Comprehensive sexuality education remains inconsistent, leaving many adolescents without knowledge and tools they need to make informed choices.
We have had young people also coming to the facility and telling us that unajua daktari, shida ni tukikuja kwa hospitali zenu hakunanga dawa. Sasa hata mtu anashindwa akuje aje because akikuja wanapata eti hapati ile huduma yenye amekujia. Lakini sasa ukianza kumwanzishia mambo mengine, you see, anaona ni kama hii ni kumwekelea na mwekelea, lakini hajapata ile yenye imemleta pale kwa hospitali. So we are telling our mobilizers is not, when you go to the facility, you are comprehensively assessed such that yes, you could have been brought for this particular service, but from the analysis, from the assessment, you are also qualified for these other preventive services. So we will cancel on that. Currently, the former NHIF, which is SHA, there's misconception in the public that without SHA, you will not be treated. See? So people are staying in the public with the infections without being treated. By the time somebody comes in, is maybe in the stage of complications of the STIs.
Youth-friendly health services are still scarce, inaccessible or underfunded, forcing too many to face their struggles alone. Through training sessions with county officials and health providers, NAYA is helping bridge this gap, ensuring that services are delivered with compassion, confidentiality and inclusivity.
I know there are a lot that have been capacity built on other aspects of health, but the aspect of advocacy and meaningful youth engagement was, it was not there at first. But right here, right now, really brought out that aspect very clear with them. And not just with the Youth Advisory Council, it has extended even to our healthcare workers, the CHMT at the county level and even at the sub-county level, and it has cascaded down to even facility level.
Right here, right now, has also supported us in doing the technical work, supporting the technical working group meetings in Kamkunji sub-county, where we bring most of the stakeholders that work with the youths and other population.
Programs like RHRN now have given us quite a huge support. When we first introduced our youth engagement holiday programs, that is, each time the youths are out of school, we bring them here. The best thing about that is that we don't control the numbers. We allow them to come as many as they want. So when we're doing our health talks and discussions and screening, then we are able to reach a very big number of youths within the community. Normally, they're not less than 200, yes.
Among the many inspiring stories is that of Deborah, a woman with disability whose journey reflects strength and resilience.
Sare langu ilikuwa kidogo. You know, I used to go to work like hata singeweza kujilipia hata rent. I used to stay with my brother. So napata nakaa na brother yangu hata hakuna kitu nampatia. At least hata ile chakula hapo kwa nyumba yote. Hata naomba my dad extra because my transport was almost 8,000. Juu naenda na tuk-tuk to and fro, and you know transport for person with disability, mtu wa tuk-tuk akiona mlemavu tu hivi, it's very expensive. Mwanzo ile time anakupandishia hiyo tuk-tuk, that is anaona it's a lot kuliko yule anaenda barabarani anapanda na 50 bob ama anapanda na 100 mpaka mahali anaenda. For me anikujie paka kwa nyumba, so I will spend like 200 ama 300.
Through trainings and mentorship offered by NAYA under the Right Here, Right Now project, Deborah has become an advocate in her own right, inspiring parents and persons with disability to see possibility, not limitation.
I'm so happy because when parents sees someone with spina bifida amefika hapo, they have wanasema kama umefika hapo mtoto wangu pia atafika hapo. And the joy of that parent, my joy is seeing that parent anangangana huyo mtoto wake, anampeleka physiotherapy, hamwachi hapo kwa nyumba, anamtoa nje, unaona? Na ile freedom ya mtoto wangu nataka next training muende na yeye. Nikimpigia simu mtoto wake tunaenda na yeye, and then next time namwambia sasa next time sitaenda na yeye, ni yeye ataenda peke yake. Wanakuwa na that fear ya mtoto wangu ataachwa na nani. So saa hii nikikuongelesha kuna mayouth wengi wanaendanga training Nairobi by themselves because the parent anaona Deborah alimanage, wacha mtoto wangu naye. So my joy ni kuona huyo mzazi ameachilia huyo mtoto kwanza for the first independency for PWD. First ni independent because si kila siku utakana mtu anakusaidia.
Her story reminds us that when one is empowered, they not only transform their lives, but the lives of those around them.
The program has been very, very beneficial to me and even to the organization that I lead. One, because of all the trainings that I've gotten through this program, I'm able to cascade that back to the communities that now I work with. I work with a very specific marginalized community, that is the sex workers and queer persons who are living with HIV, and most of them are also young mothers. So you can imagine having or dealing or working with this particular specific category of young people. What they also need more is the capacity building.
As at end of Q2 of 2025, we had reached around 46 million young people with information, the relevant information, sexual reproductive health and rights information that is tailored to their needs through an online platforms. This is social media, as diverse as the social media platforms come, through websites and stuff like that.
Right now the youths know we have facilities. Most of them did not know that we have public facilities that offer youth-friendly services. Right now they can be able to access them. The services are free of charge right now, especially if you have SHA. But even if you're not registered under SHA, you can still get those services. Then you also have the presence of the medical social workers within our facilities where they can go for psychosocial support. That is the counseling sessions. Yes.
Over the years, there have been powerful campaigns, energetic youth outreaches, and transformative trainings. Hashtags have trended, conversations have gone viral, and awareness has spread. Yet, the reality on the ground tells another story.
I come from a place where addiction has really destroyed many youths, and it is from addiction where we have challenges like rise in HIV, because with drug addiction, many youths cannot have informed decisions, so they end up messing up their lives. So growing up, I used to see many people in my community getting wasted.
When someone who does not reside in Nairobi hears about the city, they will think that our infrastructure is at 100%. They will think that we are not, it is the city, so we do not have challenges. I'll tell you that as we speak right now, the teenage pregnancy in Nairobi County is at 9%.
What will never change is the context of the lake here. And you realize it's also a key contributor for sex for fish, HIV infections. So these are things that are there. And just like you've mentioned, even when you look at the latest reports in terms of even teenage pregnancy, Kisumu ranks in as one of the top 5 in terms of teenage pregnancies.
We would wish to encourage youth to come for service provision. The fact is that our youths are sexually active. It is not like those days when we would say, wait. And they told us in one of the engagement, hiyo mambo ya kuabstain is a no for them. So they are sexually active. That is a fact that parents must accept. So even as we are talking to them as parents or as service providers, let us teach them how they can be able to prevent themselves from the triple threat. That is HIV, STIs, and pregnancy. It is very important.
These stories are more than voices. They are a call to action. Beyond the hashtag is where change truly happens, in policies that work, in clinics that welcome with dignity, and in communities that uplift their youth.
We're also thinking of using youths for youths, so that they don't come and see me and see their mom in me, but they come and get somebody who is their age mate, a young nurse, a young clinician, a young doctor, who they'll feel comfortable to open up to.
Most perpetrators, the young men, we've been sensitizing. They've been able to arrest the young men who've been doing, the perpetrators, that is, who've been violating, and maybe raping, defiling girls. They've been taken to court, and we've seen several cases. Yes, in court, others have a complete, like there's a man who was arrested and was given a life imprisonment for defiling her daughters.
We need to get more resources to healthcare facilities. When we talk about SRHR, the biggest challenge at this point is just resources. Resources in terms of access to information, resources in terms of access to commodities, access to facilities, access to SGBV and GBV centers. So we need more resources. That is something that needs to be done more.
To the funders, I'd advise that they continue with the funding to help with this capacity building for the healthcare workers. Yeah, because if it stops now, there are going to be fresh health workers who will join, who've not yet been capacity built, and we're going to be having the same old narrative. So it's supposed to be something that should be continuous.
NAYA and its partners have shown what is possible, but to protect these gains, we need more.
Kazi ambayo tumefanya hasa kwa ushirikiano na NAYA tunashukuru zaidi kuweza kuangalia makala mbalimbali. Lakini ingekuwa ni swala zuri zaidi endapo tungekuwa tunayafanya makala kama haya katika wakati ambao umeweza kuratibiwa vizuri, yani mara kwa mara, ikizingatiwa kwamba utapata kwa haya ni mambo ambayo yanatuathiri katika maisha yetu kila leo, na unapoelezea kuhusiana na masuala haya utapata kwamba kuna wengine wengi ambao pia yanawagusa kwa namna moja ama nyingine. Lakini sasa sisi kama wanahabari tuna tajriba hitajika, tuna ujuzi ambao unahitajika, lakini mwisho wa siku utapata kwamba kuna rasilimali ambazo zinahitajika ili kuweza kuhakikisha kwamba unafanikisha shughuli ya kuweza kuwatafuta wale ambao ni wahusika, usafiri pengine utoke sehemu moja ama ufike sehemu nyingine. Sasa ikija katika maslahi haya kuweza kushughulikia ukusanyaji mzima wa hizi habari, unapata kwamba kidogo zile gharama inakuwa ni mtihani.
This program has really helped the county a lot, and to the young people I'd like to tell them to make their voice be known. I will also tell them to, it say that stand out to be counted. If they don't speak about their issues, we may not know what they are going through. So through speaking their issues, even the county assembly may get to know what they are facing. So we want to encourage them to keep talking. We want to encourage the sponsors of this program to keep coming even with new programs that will continue ensuring the well-being of the health and well-being of the constituents of this county.
A healthier, more inclusive future for young people is not just a dream. It is our shared responsibility.
We will not achieve development in its totality unless we are willing to listen to the conversation that young people, the voices of young people about what they think sexual reproductive health and rights for them looks like. Because for them, development depends on how we will handle that part.
Beyond the hashtag, queer folks should take their time to get knowledge on how to access these services. They should take time to research on queer-friendly facilities. Yes, to help them walk through their journey on getting SRHR services.
Beyond the hashtag, I call upon local institutions, even local funders and policymakers in Kenya to look into local ownership. Yeah, let us just look into local ownership, because for the longest time we've been depending on aid from like European countries, and we've seen what that has like done to many of our programs, especially around HIV. So if we could look into local ownership and make sure that we own SRHR, we don't depend a lot on foreign aid, then we'll be good to go.
We call on government to increase domestic financing, on donors to invest boldly, and on all of us to keep the momentum alive.
So my message to donors is we still have a long way to go. We still need the support. We still need to work in different interventions. And currently in 2025 and even moving on forward, things have changed. We are not doing the things the way we used to do 3, 4, 5 years ago.
I would request for unrestricted funding, because then you realize that one of the things that is giving power even to anti-rights organizations is because they have unrestricted funding. And therefore, if we who are doing very important work to ensure that services are available, to ensure that reproductive justice is achieved, then we also need unrestricted funding. For the donors, we are of course grateful that support is coming to bridge the gap that probably the government is struggling to bridge. They've been able to support with the resources. They've been able to support with a new way of looking at things, so that where the government and duty bearers are not progressive enough, it has added to perspectives on what the current and the future looks like. So we continue requesting that they continue providing the support, both financial, technical, for us to continue advocating for advancement of SRHR for young people in the modern age and also for the future.
Together, let us go beyond the hashtag.
Beyond the hashtag, we are amplifying the voices of young people and transforming our communities.